With summer vacation nearly over, Ali Kathari worries about the fall.
Like any parent, I'm feeling really nervous, especially with the new restrictions being totally lifted. It makes me feel really apprehensive sending the kiddos back.
Her children are both too young to be vaccinated. Children continue to be far less likely to become severely ill from COVID-19. But as cases surge in the U.S., doctors are noticing a troubling trend.
We're seeing a lot of illness in children, both from COVID and RSV, which is overwhelming the hospital systems.
We still don't know if the Delta variant is causing more severe illness in children, but it is more infectious, and more cases mean more kids are becoming seriously ill.
We're in quite a different situation from the United States and Canada because across the country we have much higher vaccination rates. And so I think that that's really going to help us moving forward into the fall.
The chair of the Canadian Pediatric Society says it's critically important for kids to return to class, but the risk of COVID-19 is still there, especially as new cases rise across Canada.
Is it possible that there could be outbreaks from Delta in schools this fall? Yes, it is possible. And so for that reason, I think vaccination is important. I think keeping a close eye on what is happening with COVID is important.
It's why many physicians are concerned with Alberta's plan to discontinue most of its pandemic response measures next week. Pediatricians in that province sent a letter Monday to the Jason Kenney government. Although it is relatively rare for children to become seriously ill with COVID-19, it says the pediatric ICU beds could be overwhelmed if COVID-19 becomes widespread in schools and community settings. Fears that without some measures in place, hospitals here could soon experience what so many in the U.S. are seeing now. Heather, Yourex-West, Global News, Calgary.